If you look at wages by state, it's no tremendous surprise that they vary by a huge amount. In some places, PAS workers earn barely more than the minimum wage. In West Virginia and Texas, $6.25 an hour. That's 2002 to 2005 data. And by comparison, there are states where they do moderately well. $14 an hour in Delaware, $12 an hour in Connecticut. Some of the other northeastern states are also high, as is Nevada, Alaska, and Hawaii. And as usual, the South is fairly low. Of course, cost of living varies by state as well, so you know, one should probably take that into account. But so do reimbursement rates that vary quite a bit from state to state. And of course, the reimbursement rate is not the same as the wages that the actual workers get. As recently as 2001, about 60% of PAS workers had full-time regular work. But that had gone down to 54% by 2006. That's not necessarily a problem for a lot of these people. If you look at the question that's in the current population survey about whether they would like to have full-time work, actually 65% of those who work part-time said they're happy with working part-time. So it's not necessarily a problem for the workers in that sense. But what does it mean to have a low-wage part-time job? It means you don't get benefits. And in 2006, only 28% of PAS workers got health insurance benefits as part of their job, down from 40% as recently as 2002. Can you give me one? Here's some preliminary data on occupational injury that is based on some data collected by the Bureau of Labor Statistics, and they don't allow us to do the kind of distinction that we made in the population data between people who provide PAS in the community and people who provide PAS in institutions. So it's one lumped together category. And furthermore, it doesn't include everybody. It's only agency workers, not independent providers, not people who work in households and their household is their employer. So this gives you a sense of what it's like to be a PAS worker in terms of occupational injury. There is one category, nursing and home health aides, that includes quite a lot of people we classify as PAS workers, but also includes obviously nursing home aides. And these workers, this nursing and home health aide category, ranks number 8 in overall work-limiting injuries among all occupations. So what I did was I tabulated more than 250 occupations, and nursing and home health aides ranks number 8. It ranks number 1 of all those occupations in terms of work-limiting back injuries. So it's telling you what the injury actually is. It's helping people transfer. And among all healthcare occupations, it's by far number 1 in the overall rate of work-limiting injuries. Nursing and home health aides had on average 40 work-limiting injuries per 1,000 workers per year. That's 4 times the rate of registered nurses at 10 per 1,000 per year, and 100 times the work injury rate of doctors, which is only 0.4 per 1,000 per year. So this is not a very particularly safe occupation for the workers who do it. So who are these PAS workers? I think Mitch said that 67 or 69% of people providing any kind of personal assistance were women. Of paid PAS workers, 89% are women. And the median age is 45. They're somewhat educated. 3/4 have high school diplomas, but only 8% have college degrees. They're not wealthy. Half live below twice the poverty level. And there's a fair amount of representation of minorities. 30% are African American, 18% are Latino, 5% Asian Pacific Islanders. And in some places, some of these groups constitute the vast majority of PAS workers. 87% of PAS workers in the District of Columbia are African American. African Americans are also majority in Louisiana, Mississippi, and Georgia. In New Mexico, 61% are Latino. in Texas 44% Latino, and in Hawaii 80% are Asian or Pacific Islander. And a related issue is how many PAS workers are immigrants, not born in the 50 states and DC. 25% nationally, which is fairly large for any occupation. But in some places, the proportion of immigrants is really very large. In New York State, 65%, almost two-thirds of PAS workers are immigrants. In New Jersey, 53%, and in California, 46%. And it's even more dramatic if you look instead of by state, but you look at metropolitan areas. In New York City, 83% of people providing PAS are immigrants. In Miami, 80%, in Los Angeles, 68%, San Francisco Bay Area, 62%, and here in DC and the surrounding counties, it's 57% are immigrants. So in some places, immigrants are essential. Immigrants are the people who provide formal personal assistance services. So getting to what Steve Tingus brought up about the future, how do we predict what the need for personal assistance workers is going to be in the future? A naive way of doing it is to simply assume that the rate, the risk of needing personal assistance services remains constant, remains what it is today. So what I did was to take the age and sex specific ADL disability rates and apply them to the population projections by age and sex that are available from the Census Bureau. And when you do that, you start out with about 5.5 million people. This is both institutional and non-institutional. Institutional plus community people who have who need help in ADLs. You got 5.5 million now, and that's projected to increase to 13 million by 2050. So that's 2.5 times the current population level, and that's often perceived as a crisis because, in contrast, the working age population is supposed to increase only modestly over the period from just under 200 million now to about 230 million. So it's perceived as a crisis because 2.5 times as many people are going to need help, and only a small number more people in the workforce. But is it really a crisis? Well, that might be a little dubious. I mean, we have now 1 million people providing PAS in the community, so 2.5 times that, 2.5 million out of 250 million working age adults, so it's 1% of working age adults providing help to people living in the community. It doesn't sound like a huge crisis. Furthermore, this way of estimating the future need for, the future demand for PAS is naive, as I said. Is there any reason to assume that the rate of ADL disability remain constant? No, on the contrary. There's reason to assume that it might decline. Manton and colleagues, using data from the National Long-Term Care Survey, have been finding in the past couple of decades that the rate of ADL disability among elderly adults has been declining, and the estimate is about 1%, a little less than 1% per year, specifically for ADL disability. 1% decline per year, which is a lot. So suppose that decline were to continue, somewhat unlikely, I mean, to continue exactly that level, and suppose that applies not only to elderly people but also to non-elderly people, again, kind of unlikely. But that's maybe a best case scenario as opposed to my naive estimate, which is a worst case scenario. So if you apply that assumption and you project the demand for PAS, you find that goes up to 8 million instead of 13 million. So there's going to be growth, almost assuredly. I mean, the baby boomers are aging, but how much growth is not clear.